Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. I am so full of gratitude today to have a colleague here, Dr. Sally Pezaro, who is going to be talking at our up-and-coming Labor and Delivery Symposium for 2024. Another year has flown by, Sally. I can't believe it. And here we have you back at our Labor and Delivery Symposium talking about the management of childbearing with hypermobile, Ehlers-Danlos syndrome, and hypermobility spectrum disorders. We were just talking off camera. I know how passionate you are about this topic, but we were talking about the awareness that has changed over the last few years, and the impact that it's having on the clinicians and potentially the patients. And you actually said something to me there that was so profound, just talking about how some people, that knowledge can be power, but for some people, it's actually causing maybe more distress as well. The decision making when you find out that you might have, this condition, this syndrome and disorder could be quite challenging because then it gives you a flood of more decision making to make. I often talk about, decision fatigue as a big issue in healthcare, because knowledge can give you the answers, but can also cause this fatigue as well. Is this something that you're seeing? Tell me more about what's happening with the patients who are being diagnosed at this time.
Well, obviously, everybody's an individual and their own person. I don't have EDS, but people do say to me, I wish I'd have had my diagnoses earlier, then I could have got more support and I wouldn't have, got in such a mess with my physical symptoms. But then other people say, I wish I never knew. I wish I never found out because now I'm thinking, do I have children? Do I start a family? Do I not? Do I tell people? Do I not? How much do I make this part of my identity or not? And I guess that depends on who you are as a person, how much it affects your everyday life. Some people you would never know they had, hypermobility. Other people, it's pretty obvious and they'll share it openly with you. So I think personally, the more and more aware people are about these conditions, knowledge is power. And I think, with the lack of recognition and help available to people with these conditions, we really need to raise the profile of it. And I think that's happened to some extent, but obviously it needs to happen a lot more in terms of clinicians not only hearing the condition and thinking, oh, I've heard of that before, but then knowing what to do and what it might mean. And the problem is it's not clear cut. Everybody will experience it differently and have different symptoms, which makes it horrible if you're one of these pragmatic people that just wants to say, X equals Y, I've
Cut and
got this
dry.
condition, so I do this,
Yeah.
or I take this medication and that will be fixed. And I think that's part of the problem with what we're seeing now.
So interesting. Yeah, it's reminding me of other disorders. But yeah, the whole essence of I was thinking about informed decision making. So once I have the information, I'm a bit like you. I want to know. However, I've also had that experience in my life, and I'm sure people can relate to this, that having the correct support around you is really key with all of this information because it can be so overwhelming. So this is really, I feel this is where you come in a lot, in terms of awareness and research. You are trying to really make sure that the information is out there. But I wanted to wind back a bit because maybe people just dropped into this conversation. They went, what the heck are they talking about? It might be new knowledge, or like you said, there is somewhat relatively people are seeing, the types of conditions maybe cram across their desks. But let's just give them a quick synopsis of what we're talking about. Hypermobile Ehlers-Danlos syndrome, or EDS, and hypermobility spectrum disorders. Let's talk about what they are just briefly, isolated and then together.
Okay. Well, the Ehlers-Danlos syndromes are a group of syndromes, 14 in total, and some are rarer than others. And they range from, affecting, vascular systems to various parts around the body. But the hypermobility type, so hypermobile Ehlers-Danlos syndrome, is the most common one. And it has lots of different symptoms, but broadly, people with the condition will be affected by hypermobility and a hyperextensible skin, so very stretchy skin. And that's how you kind of pin that down. But diagnosis is really difficult. There's no gene, there's no kind of test we can do. It's based on assessment of symptoms and family history, really. And
Mm,
hypermobility spectrum disorders can be just as severe, but different in the way that they aren't quite the same as hypermobile Ehlers-Danlos syndrome. But interestingly, the treatment for both is the same. So
interesting.
that's why when we talk about producing guidelines for these conditions, we say whether you've got hypermobile EDS or whether you've got hypermobility spectrum disorders, the treatment will be the same.
Right. And so you said there's no genetic testing for this at this time, or we don't anticipate there will be in the future.
Who knows about the future? But right now, there is no genetic test we can do to say you definitely do or you definitely don't have this condition, which makes it hard for people, and it makes it hard for clinicians to give that label out,
Mm.
because it's not as coherent as, you've definitely got this or you definitely have that.
Yeah. And so when you have a patient, say, come into your office so that you suspect that this might be part of the makeup and maybe they have never heard of it before. So, in this context, we're talking about managing, childbirth. What do we do next? Where are we referring? International help, local help? What's the best course of action that we can do ourselves to sort of be sure that they land in the next best place? Where are we referring out to?
Well, I think there's this saying, if you can't connect the issues, think connective tissues. Stuff's going on, you can't work it out, it doesn't connect together, but maybe it's hypermobile Ehlers-Danlos syndrome. And even if you're thinking in that way, it's worth referring someone or thinking about you going to a rheumatologist, and to see if you can get more information about this, and also read our guidelines and read the evidence out there about this to see, what the criteria is, what symptoms you do and don't have, how can you map yourself to this or not. And then with the rheumatology, they're obviously the experts in kind of diagnosis, etc., but also physical therapy and physiotherapists are really your best friend, if you have some of these symptoms.
Excellent. So it's really people that are already connected in this manner. They know what to look for. Like you said, physiotherapists, rheumatoids, specialists are going to be the best course of action. So tell me now, where we're at. So fast forward, when you first started researching this and it was brand new on the scene, people were just going, what, where? We've seen it for a while, but we didn't really know what the title of it was. Where are we today? How do you feel about the research, the international scope that you've been able to, pull together? Tell me a bit more about that.
Well, obviously, our research is focused on pregnancy and childbearing. And a lot of the research that's out there, we've actually had to extrapolate, and think about, okay, this happens in populations with EDS. How would that relate to pregnancy,
Right.
rather than the research being done on pregnant people alone? But the research we've done has been on people who've had pregnancies and their outcomes. And that's been really exciting. To understand more about what is more prevalent in these populations than what is not. But what we don't know is why. So
Mm,
we know what, but we don't know why. So the mechanisms are missing for me in terms of understanding what's behind those high prevalences. And then, will we ever fix the symptoms? Probably not. It's probably a case of managing what happens as a result of knowing you have these symptoms or this hypermobility, and preparing as best you can, and maximizing your chances for the best possible outcome.
so interesting. So essentially, I feel like there's a lot of work to be done in this area. As far as, international research, are you seeing more people pick it up? Are you starting to connect with more people around the world?
I think since I've started understanding more about the condition, I've definitely seen more people within the profession of midwifery, because I'm a midwife by background,
Sure.
um, come to me and say, yes, I've heard of this condition now. It wasn't something we ever looked at before, but now we're understanding more about it. And that's exciting, because I don't think it's ever been as well known in the birthing world, as it were.
Sure.
Um, as something that was a thing. And of course, we sometimes forget that when people are pregnant, they're not just pregnant. They may have other conditions
Sure.
that they had prior to pregnancy that may well affect that pregnancy. So for me, that's quite exciting to think about making waves in that area and discovering new ways to help people where they previously were just left not understanding what was happening. And
Mm.
healthcare professionals often were like just bamboozled by these unusual things that were happening and not connecting those dots together to think, hang on a minute, this could be EDS.
Yeah, absolutely. And then I was thinking about the fact that we work with families also in that postnatal, postpartum period as well, and the impact that it could have on them. You were just talking about even holding a baby, let alone holding it in your womb, but now you're physically holding that baby. And so have you seen cases where it's not actually identified until later on that the actual childbearing or the birthing experience is good, and then you start to see things showing up postnatally as well?
Yeah, it could be, that the pregnancy goes particularly, quite smoothly, for example, and nothing abnormal is notified, and then, the birth happens, perhaps a cesarean section, or perhaps a tear happens, and it just doesn't heal, and we don't understand
Right.
why it's not healing. That's
Yeah.
quite unusual. Usually this should be healing. Why isn't it? Or the wound's reopening. And that's not typical for healthy pregnancies. So that could bring to light, hang on a minute, why are these tissues behaving differently in terms of healing? And that could alert you to someone having hypermobile Ehlers-Danlos syndrome.
Yeah, this really seems like it's something that should be on everyone's desk who, who's working in that perinatal field to watch for because of the complexities. I think it's the layers that I'm seeing. There's so many layers in, EDS, and then the layers of childbearing. It could be a perfect storm, I think, for so many, parents who are pregnant.
Yeah, yeah, absolutely. It's just, people thinking about, how am I going to care for this baby? How am I going to think about my parenting capabilities when I'm struggling on my own to
Right.
get through my working day or brush my teeth or whatever it is that they've got issues with, and then they've got someone who's dependent on them, and they're having to do those repetitive tasks or tasks of parenting that need you to be in a certain position for a certain amount of time. And if they don't have the proper understanding or support around that, it can be really,
Mhm.
really challenging as a new
Yeah.
parent.
How well are we doing with peer-to-peer support right now in support groups? Are we starting to see those groups pop up so that friends can get the support they need and understanding?
There's definitely some large online pregnancy support groups relating to hypermobile Ehlers-Danlos syndrome and hypermobility spectrum disorders, which is great to see.
Hmm.
And there's often kind of hints and tips shared between people and understanding, which is really useful. And hopefully, the evidence base is being shared as well, so that people can make evidence-based decisions about what's
Sure.
best for them and how they can best care for themselves and their babies.
Yeah, yeah, I can see that that would be really important, but making sure that you've got that alignment, with the latest research. And it seems like things are still moving fairly quickly, and getting folks up to speed is still one of the challenges. Is that what you're sort of seeing in the field as well?
Yeah, I mean, these guidelines were so in demand. People have been demanding them for a long time, wanting these pregnancy guidelines. And actually, when the Ehlers-Danlos Society shared that these guidelines were being developed, they said they had the most interactions on on their pages that they'd seen in a very long
Wow.
time, because people were excited for these to come out. So there's a lot of pressure on us to get them out and get them right. Um, and they're still quite new out, and
Sure.
we hope they're quite kind of simplified for people, not overcomplicating things too much. But even then, the Ehlers-Danlos Society currently is working on an information page which kind of breaks it all down for people who are just looking for a quick bite of what should I look out for when for these
Mm.
guidelines. So even now we're trying to make sure that knowledge is mobilized and it doesn't just sit in a journal somewhere. It can be used by people in a tangible way.
Well, I'm really excited to have you back here at Gold Learning and at our Labor and Delivery Symposium. I know your presentation, of course, is absolutely fantastic. I got a little bit of a sneak peek of that today. But tell me again where we can get these guidelines, because I know people are going to be hungry to go get them again. Where are they right now, Sally?
So at the moment, they're very newly published in PLOS One, so that's the Public Library of Science, and they're published alongside the methodology for how we actually co-created the guidelines and the scoping review we did alongside it of all the evidence and quality appraising all of the data that we found. But it's quite a long document and it's quite complex. So I'm hoping at some point it would be on headstogether.com and also on the Ehlers-Danlos Society website where you can find out more information.
That's absolutely fantastic. Well, thank you so much again for being here today. It's always great to see you and get updated. I feel that this work is just going to continue to expand, as we keep these conversations, and who knows in the future what sort of guidelines will look like and what sort of, resources we'll have, and maybe even some genetics as well. So thank you again for being here today.
Thank you very much for having me.
Yeah, we'll look forward to seeing you online, everyone. Don't forget, you can head over to goldlearning.com right now and register for our labor and delivery event 2024. It's going to be a great year. We also have a free keynote for you as well, and I'll look forward to seeing you all online. Bye-bye for now, everyone.